Today's speaker is Beth Stapleton. Was introduced to the American Foundation for Suicide Prevention after the death of her son. She's now statewide volunteer coordinator and a board member. She will tell us the history of the foundation and explain how it fights suicide, supports survivors, and advocates for mental health. Beth, welcome to the Old Guard.
Okay. I appreciate that introduction, and thank you so much for inviting us in to talk to you. This is such an important topic, and I appreciate your willingness to invite us in and include this in your meeting. Now, I know that this is a group that typically has a lot of questions, so I'm just going to ask that we keep those until the end, and we'll take the questions at the end. So we'll go ahead and get started. So about AFSP. Established in 1987, the American Foundation for Suicide Prevention, or AFSP, is a voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy to take action against this leading cause of death. AFSP is a leading nonprofit organization dedicated to saving lives and bringing hope to those affected by suicide. We create a culture that is smart about mental health by engaging in the following core strategies: funding scientific research, educating the public about mental health and suicide prevention, advocating for public policies in mental health and suicide prevention, and supporting survivors of suicide loss and those affected by suicide. So today, the American Foundation for Suicide Prevention combines science and grassroots efforts and gives those affected by suicide a nationwide movement of over 1 million people with chapters in all 50 states. The New Jersey chapter is fueled by the mission to save lives by providing education and support to the Garden State. The grassroots work we do focuses on eliminating the loss of life from suicide by delivering innovative prevention programs, educating the public about risk factors and warning signs, raising funds for suicide research and programs, and reaching out to those individuals who've lost someone to suicide. As part of AFSP's nation network of chapters, we bring people together from all backgrounds, from individuals, families, friends who've lost someone to suicide, mental health professionals, clergy, educators, students, and so forth. We bring all together to focus on suicide prevention. So why we fight for the cause? Mental health is becoming better understood, and we're actively reducing the stigma. We're seeing a shift in how individuals and the nation speak about mental health and suicide, and there's continued growth and collaboration in this field. According to a recent AFSP-sponsored Harris poll, 94% of Americans think that suicide is preventable, and 94% would do something to help if someone close to them was thinking about suicide. Each of you, by inviting us in today, is part of that 94%, and we thank you. So together, we can encourage those who struggle to seek help, to improve the quality of their lives, and stop this tragic loss of life. By joining in today and sending the message that our cause of suicide prevention is important to you, you're showing others that suicide, which is currently the 12th leading cause of death in the U.S., and the second leading cause of death of those 24 to 34-year-olds, cannot be ignored. Suicide is a health issue that affects all of us. As a community, we know we have much to do as we lose more than 45,000 lives every year in our country. And while we're saddened by these deaths, we do see them as a call to action for our nation to do more to prevent suicide. Also, suicide deaths and attempts cost $69 billion in combined work loss and medical costs. And it's also estimated that for each death, there are 25 suicide attempts, or more than 1 million suicide attempts per year. And despite these staggering statistics, in the US and worldwide, spending for research on suicide is considerably less than research spending for many other diseases and conditions. So how we fight for the cause. AFSP is leading the way in suicide prevention research. As mentioned earlier, much of what is known about suicide comes from AFSP-funded studies. Our studies open up new areas of inquiry and help set the national research agenda. Thanks to our donors, last year we invested in 37 new research grants, totaling $6.44 million. And over the past 5 years, AFSP has awarded over $23 million in research funding. Through our educational programs, we teach schools, communities, and workplaces how to best prevent suicide and create a culture that is smart about mental health. AFSP currently has over 30 educational programs. Many of these programs are brought to your local communities free of charge because of the funds we raise in our Out of the Darkness walks. We provide the opportunity for local volunteers to be trained to present community and school-based programs such as Talk Saves Lives, More Than Sad, and It's Real. Due to COVID-19, we were giving both Talk Saves Lives and It's Real as virtual presentations, but we've opened that up now, and we've actually learned that virtual presentations, just as you're learning, that this is a great way to meet when you can't always get together. So we are doing both now. So we're doing a combination of in-person and virtual programs. And just as one note, Talk Saves Lives is a great community-based program that talks about the scope of the problem of suicide, warning signs, risk factors, and things that you can do if you're worried about someone. So that might be a good program if you're considering a follow-up to this presentation today. We recently launched a new program called Finding Hope, Guidance for Supporting Those at Risk. This program gives participants practical guidance, research, and encouragement to support the person with lived experience in their lives. And we use the term lived experience for someone who has either made a suicide attempt or has suicidal thoughts or suicidal ideation, as we call it. So we refer to that as lived experience. So someone who is supporting a loved one with lived experience, we've created this new program for Finding Hope. And through our International Survivors of Suicide Loss Day and Healing Conversations programs, AFSP provides support year-round to those who have been affected by suicide. The International Survivors of Suicide Loss Day is an event in which survivors of suicide loss come together to find connection, understanding, and hope through their shared experience. And while each event is unique, all feature an AFSP-sponsored documentary, which offers a message of growth, resilience, and connection. In New Jersey, we work with partners to host 7 events across the state. In fact, our most recently added event was one that I helped host in Madison, and it was our first time last year of having an event in Madison. But these are national events that take place the Saturday before Thanksgiving. The holidays can be a tough time for people who've lost a loved one to suicide. So we bring people together that Saturday before Thanksgiving to try to give them some hope and support to face the upcoming holidays. Our Healing Conversations program gives those who have lost someone to suicide the opportunity to talk with our experienced volunteers. These AFSP volunteers, who are themselves survivors of suicide loss, offer understanding and guidance in the weeks and months following a suicide death. Available in person, on the phone, or by video chat, our volunteers are familiar with the isolation that so often accompanies a death of this kind and are able to show suicide loss survivors a way forward into a world of support. And by creating an opportunity for newly bereaved people to speak openly with and ask questions of someone who's been there too and truly gets it. So advocacy and public policy. We're very fortunate to have a dedicated public policy office in Washington, D.C. This group works 365 days a year to provide information, education, and advocacy for federal and state legislation. We now have over 25,000 advocates representing all 50 states. Advocating for smart public policies regarding mental health and suicide prevention is a key component of AFSP's mission of saving lives and bringing hope to those affected by suicide. Field advocates are the driving force behind some of the most important work AFSP does in encouraging important legislation that takes mental health and suicide seriously. We do have a program where you can join to be a virtual field advocate. It's very easy to do and takes less than 3 minutes to sign up. So I can make sure that you all have the link to that in case anyone's interested in signing up to be an advocate. So our walks are how many people learn about the organization for the first time. We welcome them into a supporting and loving community and mobilize them in the movement to stop suicide. In 2021, New Jersey had 16 Out of the Darkness walks take place with over 11,000 registered walkers, and we raised over $1 million. We're actually about to go into our walk season, which starts in September, and it goes through the end of November. This year, we actually have 13 walks across the state. And we're very excited to kick off with 2 different walks, one in Atlantic Cape and the other one right around the corner. So on September 9th, the walk in Morris County is taking place, and that's in Chatham. So if there's anybody in the group that's interested, you can learn more at afsp.org/Morris County. But this has been a great walk for us. I think they've been doing it for 4 or 5 years now, and it is the closest in our area. So next, wanted to touch base on our Project 2025. The American Foundation for Suicide Prevention has set a bold goal to reduce the nation's annual suicide rate 20% by the year 2025. Despite the fact that more is being done today to prevent suicide than at any other time in history, the rate of suicide continues to rise in the United States. So with guidance from top minds in the field and dynamic data modeling, AFSP has determined the programs, policies, and interventions that will prevent as many suicides as possible. And Project 2025 is the collaborative effort to implement and scale these strategies nationwide. So AFSP has identified 4 critical areas which represent the highest potential to reach the most people at risk in the shortest amount of time. And the first is firearms. So by working with key partners, we can educate range, retail, and broader firearms owning communities on how to spot suicide risk and to know what steps they can take to save lives. And we believe that if half the people who purchase a firearm are exposed to suicide prevention education, we can expect to save an estimated 9,500 lives through the year 2025. We actually have a version of our Talk Saves Lives program that I mentioned earlier that is specifically tailored for the firearms owning community because we think that this is so key to get this information in the hands of people who are purchasing a firearm. The next would be healthcare systems. So this includes both primary care and behavioral health. And Project 2025 is collaborating with the country's largest healthcare systems to accelerate the acceptance and adoption of risk identification and suicide prevention strategies that we know work. And by identifying 1 out of every 5 at-risk people in large healthcare systems, such as during a primary care or behavioral health visit, and providing them with the right support, we can expect to save an estimated 9,200 lives through 2025. Next category is emergency departments. Basic screening and intervention can provide a safety net for at-risk patients seen in emergency departments. Project 2025 is educating emergency room medicine providers to improve the acceptance and adoption of suicide screening and prevention intervention as the standard in emergency care. And by screening out people seen in the emergency rooms and providing short-term interventions, we can expect an estimated 1,100 lives saved through 2025. And then lastly, our correction systems. We need to change the culture of suicide and prevention in our country's jails and prisons. And by screening for and identifying 50% of at-risk individuals and delivering comprehensive care that addresses both physical and mental health, we believe we can save an estimated 1,100 lives through 2025. So next, how to get involved. So if you would like additional information on how you can get involved, you can participate in, that should say Morris County Walk. My apologies for that. You can get involved in the Morris County Walk. That's probably the closest to you. that's coming up, as we said earlier, in September. You can sign up to be a field advocate. As I mentioned earlier, signing up to be a field advocate takes about 3 minutes. They ask some basic information, including your address, so they know who your representatives are. And what happens is whenever there's legislation that AFSP feels strongly about, you would get an email alert asking you to review the topic, review the information, and if you agree, with a couple of quick clicks, you can actually communicate with your legislators. We always encourage people to reach out to their legislators. They really do want to hear from us, and it's important that, that we connect with them as their constituents. So other ways you can get involved. You can partner to bring education to schools and communities. Even this presentation is a great way to get involved. We can continue that partnership if you want to have additional information presented, or if you have recommendations for other organizations that might benefit from this information. Our volunteers get trained to present AFSP programs. We actually have about 30 programs that we offer. Some of them are presented by, volunteers like myself. I don't have any special training. Others, like the program we mentioned earlier, Finding Hope, those are offered specifically by clinicians. So we ask therapists and clinicians to get involved with them so that they can be there to support people. So we encourage you to get trained, and we encourage you to volunteer with the New Jersey chapter in any way that you're interested. If there's more information that you like, certainly we'll open it up for questions shortly. But you can visit our website at afsp.org/New Jersey. And you can follow us on social media. We're on all of the usual platforms, including Facebook and Twitter and Instagram, so that you can follow us there as well. So I just wanted to thank you all again for inviting us in, inviting me in to talk with you today so that we can share some of the work of the American Foundation for Suicide Prevention. We believe the more we talk about suicide and mental health issues, the more we'll reduce the stigma that surrounds it, more people will open up to accept help, and the more we'll be able to save lives. So again, thank you. Appreciate your attention. So, not sure how. Okay, go ahead.
Thanks very much, Beth. It really is important that we hear from you. And if there are questions, how do we do that, Paul?
Yes, I'll call the names, and Joel will send unmute requests to people if they need them. But the first one is Mark Edelman, and he's already a co-host.
Hi. I'd like to know if you can give an example of a legislative initiative that's being advocated, preferably something in New Jersey, but if not, then something anywhere, just to explain what sorts of things are being advocated today.
Absolutely. We just actually had a couple different events in the advocacy area. So fortunately, I've got it all right here. I remember two of them really well. But so there were three different policies that we came together with the Society for Prevention of Teen Suicide and AFSP. We partnered together to advocate on behalf of. There were actually three different policies in New Jersey that we felt really strongly about. The first one was basically suicide prevention policies in schools. And that was to require that, that schools adopt suicide prevention and postvention policies. So if there's been a loss in their community, postvention policies, and that we have model programs that are available for them. We're very concerned about the rates of loss to suicide among our youth, and even the rates that we're hearing them express concern, right? Even those talking about suicide. And, so we're very concerned that those numbers continue to increase. So that the school suicide prevention policies was one. The next one really kind of surprised me that it was even an issue, but the bill is called A4604 or S682, Mental Health Provider Suicide Prevention Training. To be a therapist or a clinician in New Jersey, you are not required to take any suicide risk assessment training at all. So that to me is a huge miss. I mean, I think the fact that we've got clinicians who are meeting with people who don't necessarily know how to assess risk is very problematic. So we're recommending, I think it was 6 hours of training over the course of, I believe it was 4 years. Just because these clinicians need to understand how to identify the risk. And then the final bill we were advocating for was one that required insurance companies to pay for annual mental health screening. Insurance companies now pay for an annual physical, right, as part of preventive medicine. So that third policy is A 1141 or S 2790. So it would require an annual insurance companies to pay for an annual mental health screening as well.
Can you just clarify what a mental health screening consists of?
Well, I mean, I think it would be a check-in chat, and it could even include your primary care physician. I mean, my primary care physician, when I go for a physical now, they do ask me a series of questions about how I'm feeling in my mental health. So they'll ask if I've been feeling depressed or I've been feeling anxious, and they'll ask a series of questions. So, I mean, I'm not sure of the exact questions that they would ask, but it would be a series of screening questions just to make sure that there aren't any red flags that needed to be noted there.
Thank you.
Mm-hmm.
Okay, next is Mitch Erickson.
Yes, hi. Thank you for what you do, and thank you for a good presentation this morning. What can you tell us a little bit about the differences in tactics across the age groups in terms of suicide prevention? Because I assume it's different if you're talking to a 13-year-old than an 80-year-old.
Yeah, I mean, I think what I would say is, the common approach is really to just be open and talk about it, right? I think that's the one thing that I have learned in going through a lot of different trainings. I recently took an ASSIST training, which is Applied Suicide Intervention Skills Training, which is a 2-day program. And I think what I've learned throughout all of these things is that you have to listen without judgment. Regardless of age, right? You don't immediately react and be shocked. And the other thing is you have to be willing to ask someone that you're worried about if they are thinking about suicide. I think that is a word that we all shy away from, and it's a question that, first time somebody said to me, well, that's what you need to do. You need to ask the question. We all try to say it a different way. Are you thinking about hurting yourself? Are you feeling sad? But you have to ask directly because that does a couple things. It lets the person know that it's okay in case they have to say yes, that you're not going to be shocked or upset or angry. And it also doesn't give them an opportunity to kind of divert this. No, I'm not thinking of hurting myself. No, I'm fine. If you just say hurting yourself, that can mean a lot of different things. So I think the one thing we encourage you to do is just, talk about it and talk about it openly and directly. Another thing I would just suggest is that, we've got the new 988 number that's about a year in, right? We have this 3-digit number 988, which is the suicide and crisis lifeline. Anybody can call. I mean, it doesn't have to be the person in crisis. So if there's somebody in your world that you're worried about, you can call and say, look, I'm worried about my friend, my child, my partner, this is what's happening. Can you direct me? Can you guide me on how best to handle this situation? So that's a resource for all of us, not just for someone in crisis. We do have a program because you asked for different strategies. I mean, we do have that Talk Saves Lives program is kind of our basic community program that we add on to for different communities. So, for example, we have an LGBTQ version. We have the firearms version I mentioned earlier. We also have a senior version because we do know that, middle-aged white men are at high risk for suicide as well. So we do have kind of a senior version. And we do recognize that seniors have a different set of issues that may lead them to think about suicide. So there's different versions of that training program, but the strategy for dealing with someone who's struggling is usually the same. It's talk to them, be open with them, be there for them, and listen without judgment, I would say, are the key things.
Thank you. Jim Blinn.
Yes, thank you for your program. Very interesting. The question I have is, you said there were 45,000 deaths by suicide. And I've often heard that of all the gun deaths every year, half of them are due to suicide. And so I wondered, of that 45,000, how many of those deaths are by guns?
I can't tell you how many of the 45,000, but I can tell you in New Jersey, it's usually about half. Okay, usually about half of all suicides in New Jersey are by firearm. In contrast, you go to Colorado or Montana, probably 80% of their suicides are with firearms in those states that have very different gun control laws. But in New Jersey, it's about half.
Okay, just sort of something that I also had heard was that suicide with guns is 95% successful, whereas suicide by other means is like 2 or 3% successful. So that's another scary thing.
Yes. I mean, we refer to, the way someone takes their life as lethal means. And I think that's one, if you're worried about someone, one of the first steps that you take is to, ask them if they are thinking about suicide, but it's also to kind of remove them from any lethal means, right? So if you do have a gun, it's making sure it's locked up or putting a gun lock on it or taking it away out of the house. You're right. Those statistics are pretty scary. I mean, 50% of all the guns purchased end up being used for suicide. I mean, people purchasing a gun thinking, protection, whatever they're thinking. The fact is that 50% of people who died by gunshot are suicides. So that is a very staggering number. And you're right, it typically is very successful, if that's the right word to be used. Yeah.
Thank you.
Mm-hmm.
Ron Hoke. Oh, sorry.
I was just going to say the other thing that's kind of, an interesting statistic is that boys and young men are 4 times more likely to die by suicide, but girls and young women actually attempt more frequently. And that may also go to your comment about means, the different methods that they choose to attempt with.
Thank you very much. This was a very interesting discussion. My first question was just answered. I wanted to get a picture of what fraction of suicides were done or caused by the use of guns. It would seem to me that this is an argument that could be used in order to get a better handle in this country on gun control. I don't remember seeing very much in that way that this argument that so much of the issues concerning guns are related to suicides. That was the first thing. The second statistic, could you give us some idea of what the number of suicides are as a function of age?
Well, I mean, I can tell you that, again, as I mentioned earlier in that group, that 10 to 34-year-olds, it's either the second or third leading cause of death among that group. But in terms of the number of suicide deaths per 100,000, it really is that, kind of middle-aged white men, that tend to have a higher rate of suicide. And I think it's not necessarily a leading cause of death because when you get to that age group, there are other leading causes of death, right? And I think even COVID kind of pushed suicide back in some of those numbers. But older people, we don't often think of suicide as an issue with older people, but it is definitely an issue. I don't have the exact numbers with me, but I think we often talk about teens and young people, but it is an issue across the board. And I think recently in the CDC information, I think that was published with the most recent statistics, we now are seeing an increase among, some of the racial minority communities that are going up. So, some numbers were stabilizing a little bit, and we felt for 2019 and 2020, the numbers dropped actually a little bit. So we were feeling pretty good about that. But then unfortunately, 2021, they jumped considerably, up 4% overall. So, we're not making the kind of progress we had hoped to make. And it just feels sometimes where one group starts to make some improvements, and then we see an increase in other groups. So it's just, I don't have the exact numbers. I'm happy to gather those up and send them to you guys if you're interested.
Quick follow-up, Beth. What about the group of veterans? We'd heard in the past very high rates. How have they been doing lately?
There continues to be a problem. Veterans, we partner with a lot of the veterans organizations. We've done a couple different stand down events. There's a COVA event that we're looking to attend, which is Keep Our Veterans Alive. So it is a big issue. I believe the nationwide number is 44 veterans or active military die every day.
Yeah. Okay, so we have a very special person to ask a question now. Arch Nisley, many of you may not know, but he and his wife recently moved to Connecticut, but he still drops in, and he's been involved in this program. So Arch.
Thanks, Paul. I don't have a question per se, but I appreciate and admire the work you do, Beth. I serve on the board of Caring Contact, and it's good to see there are multiple approaches toward preventing suicide. So I just wanted to give you a thank you very much, and please keep up your good work.
Oh, well, thank you for your work with Caring Contact too, right? That's one of the 5 call centers that we have.
Yeah. Appreciate it. Thanks.
Thank you.
Great. Thanks. Mark, another question?
Yeah. Can you say anything about whether there's been a trend that's related to current politics and issues, or maybe issues like climate change or the troublesome type of politics we have today? Today there's a phrase that people use, doom scrolling. It reflects a very negative view of the world. Do you see something happening that's different today in terms of whether people's view of the world and of the future is affecting suicide?
This research that I have seen or heard about through one of our board members, we have a board member who works at Rutgers and is part of that group that collects and analyzes the data from schools, where we actually survey, children saying, how are you feeling? Have you thought about suicide? Have you thought about it in the last 2 weeks, last month, that kind of thing. I mean, those numbers are startling and they are going up. I couldn't tell you what the cause is. I know that a lot of people feel like COVID impacted that, but I think there was the silver lining to COVID in that people are talking about mental health more than they ever did. And I don't know if it's this current climate that is so negative. I hear what you're saying and I understand. Unfortunately, I don't know the answer to that.
Thank you.
Rick Smith. Oh, I have to send you an unmute request.
Okay, thank you, Paul. Thank you, Beth. Very, very useful presentation, and also my condolences on the loss of your son to suicide.
Thank you.
You're doing very good work with this group. I don't really question, but I just want to relate a couple issues really to back up your point, about recognizing signs. Decades ago, one of my coworkers had lost his wife after a long battle with cancer. He was despondent, and then he was, giving away his possessions. He was trying to arrange for someone to take his pets. So one of my friends at work and I went over to his house, after work, and we talked to him, and we found out, yes, he was, thinking about suicide even, within the next day or two. So we were able to get him, professional help within, by the next day, and it helped him, and he did remarry. There was another employee who was actually a trained counselor who took her life. And no one had really any idea. We didn't see any signs, and even her sister came at our workplace one time to talk to, our coworkers to see if, if any signs were there, or just to try to understand it. So I just, in my own experience, it's good to look for the signs, good to know what the signs could be and get help immediately. Don't, take, you really need to talk openly to persons who might be considering it and get them help as quickly as possible. It did, in my own experience, it did help at least us, we think save, one of my coworkers, from going ahead and, taking his life. So thank you again for your work that you do.
Well, thank you. I appreciate your sharing that. And you're right. I mean, it's scary to do that, but if you are worried about someone, talking to them, and then if you don't know what to do, call 988, let somebody guide you through what that process looks like. Before, taking all the training and all the information I've learned, I would not have known how to handle that. I obviously didn't know how to handle it. But now, there are people there who can call. And the one thing that people always seem surprised at is you don't have to be the person in crisis to call 988. You don't even have to be with them necessarily. You can just call 988 and say, I need help here. What guidance can you give me? And one of the nice things that they do now, especially for someone in crisis, is they do this kind of warm transfer, where if they've got someone on the phone that they really are concerned about, they will do this transfer to get them, a screening or to get them immediate help. But it's not like when you call a big corporation and you have to tell your story all over again. They will tell the person picking up exactly what the situation is and what they need to know and transfer you so you don't have to go through that. Because as you might imagine, if you're in a crisis, the last thing you need to do is to repeat your story to 3 different people. So I think that was the nice, addition to what they're doing in terms of handling those calls.
So I have a question. I don't think you've mentioned drugs, and obviously there's an epidemic of drug overdose deaths in this country, and I guess an accidental drug overdose is not categorized as a suicide, though surely there are quite a few that are probably intentional, and I guess that's one lethal method. But I mean, sort of how do drugs fit into the general picture of what you do?
Well, I think what we recognize is that a lot of people who are taking drugs are self-medicating, for one reason or another. And that there is a lot of overlap between what we do with suicide prevention and the issue of drug overdoses. I mean, many of the events that I go to, I see a lot of people who are, drug counselors, and, I see a lot of the same groups go, because I think there's an overlap there. I think when you see people, who have this pain, that's causing them to get to the point where they feel like they want to die, a lot of them are self-medicating to get through. So I think there's a lot of overlap with addiction and mental health issues and suicide.
And actually, there's one specific thing. There's physician-assisted suicide for people who are terminally ill and in great pain. So what is your organization's position on that?
Honestly, I'm not sure what the organization's position on that is. I think that's a very different situation.
Yeah.
Someone is facing imminent death. It's a very different situation. I'd have to find out what their position is on that.
Yeah.
Not sure, but a good question.
Okay. So Marv Gersten, you're next up.
Yeah, Beth, the organization is doing such critical work. I'm just wondering, with the rash of anti-trans laws now coming into effect, are you dealing with it? How are you reacting to it organizationally?
Well, I mean, our organization takes, a very clear stand, that we support the LGBTQ community. We support, life-saving medical treatment, affirming medical treatment, where a doctor agrees that it's something that needs to be done. I mean, this is a community that has always struggled with having probably 3 times the suicide rate of other populations. So it's just having them targeted in this way is so unfortunate, because it just, it's that that feeling of different and otherness and being a burden and not being accepted. I think that, that adds to someone who is already struggling. So I think it's a shame what's happening, honestly.
Jim Blinn.
One thing, if I can just go back to that, I just wanted to share that one of the things that we did in New Jersey in response to that is we did hear from, it was a Jewish Family Services organization who, because they've seen the increase in requests from the LGBTQ population, for just additional therapy, we actually gave funding to them. AFSP New Jersey, kind of made a grant to them so that they could get their clinicians trained in attachment-based family therapy, which is a therapy that we found to be pretty effective with suicide. So, that's one very, specific way we responded to that. When we got the call, we're hearing from this population and we don't have necessarily the capacity to handle it. Can you help us with that capacity building? We responded and funded that training. So that's just one specific way.
Mm-hmm. Jim Blinn?
Sure. Yeah, there's been a lot of talk about how social media for kids are online and they get bullied into committing suicide. And I know I recently saw a program on television where a lot of those folks, their parents and survivors are suing the social media companies. So how do you handle the social media aspects of bullying and so forth?
Yeah, I think social media and bullying, all of those are issues. I guess, and again, I'm not an expert in this area, but just from the research that I've done after having lost my son, I think someone does not take their own life because of one thing, because of an event. Person doesn't take their own life because they got divorced or lost a job or something happened. There's always much more to it. And usually there's an underlying mental health condition there. So I don't believe that it's a singular thing that causes it. I always think about it as like a perfect storm, right? It's like these multiple things happening, but what we all see from the outside is we see this one, event. We see this one, I lost my job, or this happened, or it was a breakup or bullying. You see that external event, but you don't know what all those other issues were that were going on with the person. They may have been struggling, for months or years with mental health issues. And that it's more of I see it more as a perfect storm or a breaking point that people get to, I think, sometimes.
Mark Edelman.
Yeah, I keep thinking of more questions. New Jersey is such a diverse state culturally. Is there a cultural group in our state that has a different attitude towards suicide? We all know that, for example, in traditional Japanese culture, suicide was looked upon differently. Is there such an issue today here in New Jersey?
I talk to all of our new incoming volunteers. That's part of my role as a volunteer coordinator. And what I find so interesting is that people coming from all different cultural backgrounds, many of them say a lot of the same things. They say, oh, it wasn't okay to talk about feelings in my house. They could be, it could be a Black American, it could be Indian American, it could be, Latinx. All these things in my community, in my household, we didn't talk about feelings. We didn't say we were feeling depressed or, so, I don't know that there's a group that seems to be doing it really well or have a different attitude about it. I do think that there's been a shift for a lot of people because of COVID, because people are more openly talking about mental health, just because everybody was locked down and struggling during that time. And the more people that speak out about it from the different communities, I think really helps people open up about it more.
Speaking of specific groups, what about homelessness? Is there a connection?
That's a good question. I don't know. I don't know, but I know there's an overlap with homelessness and mental illness, right? We know that, that many people who are homeless have mental illness issues that they're dealing with. So, but that's a good question, but I'm not sure about the tie into that.
They might be more difficult to reach out to as well because
Absolutely.
they don't have smartphones and telephones and things.
Yeah.
Ron
I would
Hulk, sorry.
Just one quick comment. It's not easy to find help either. Like, even in New Jersey where we've got lots of resources, I had a friend who reached out concerned about her son. And even with all the connections I have, I couldn't just put my finger on, this is what we should do. So it's not easy to find everything. So there is one website that's preventsuicidenj.org. And I can drop it in the chat later, but it is one that has a lot of resources in one place. I mean, we got a grant and worked on pulling that together so that you would see a lot of resources in one place, because it's not easy to find. If you're just looking for help, what's the best thing to do? What's the first step I should take?
Ron?
One more question, please, about some statistical information. Do you have any information about the causes of suicide as a function of age group? In other words, what is the method primarily used by young people versus middle-aged people versus older people?
I don't have any information on that by age group. I mean, the only time we really get into method is when we look at kind of firearms versus other methods, because we know that firearms are so deadly. So we do know that men typically are more likely to use a firearm than women. I'm not sure about age group, to be honest with you. I mean, if that's something you're interested in, and I can try to find out and send that information along.
Thank you.
Arch.
Okay, I do have some more stuff now. So, talking about COVID and like the increase in call level at Caring Contact, we received a lot more calls percentage-wise during COVID. And a lot of the calls were from very young callers, teenagers, even preteens. Seems like families were all packed into the house and there was no breathing room for anyone in some cases, and things really came to a head. I think that's leveled out a little bit, but we're actually trying to proactively target seniors now with some programs. I think we're talking to Meals on Wheels right now, and maybe, sending us some information. Someone who delivers meals could give information to a senior, because I know a lot of seniors are isolated. So that's definitely a kind of a proactive target for us right now at Caring Contact.
That's great. And we do know that isolation that comes with, physical, restrictions is a big problem for seniors. And that is, so that's great that you're doing that.
Are you doing that with a group in Connecticut now, Arch?
Sorry. Now I'm trying to sort out what to do. I'm still on the board, back in New Jersey, but I have another year or so to serve on that. But I haven't actually been listening since I moved to New Jersey. So I was a listener and a board member, and I haven't been an active listener. And I'm trying to sort out what my next step is. I think I'd really like to get involved with some kind of program or some kind of situation up here more locally.
Yeah. Jim Hewitt?
Okay. With regard to that question of age, when you were giving statistics, Beth, you noted that the age group from 10 to 34, suicide was the second largest cause of death. That seems counterintuitive in that generally we think that young people have lots to look forward to, and yet your statistics suggest something very different. What do you think accounts for such a high percentage of deaths in that age group?
Yeah, well, I think first, because it is a younger age group, people are less likely to die of natural causes, right? So it's not like, that there are these other natural causes that when you get to, more senior people, you're looking at those numbers and you're comparing them. But I mean, there is a crisis with our young people right now. No, there's no doubt about it. There are more of them thinking about suicide. There are more of them struggling, and telling us that they're struggling than ever before, which is why I think some of these programs we talked about with the policy for schools is just so important. We can't wait till high school anymore. Kids are struggling as young as 9-10 years old, which to me was shocking the first time I heard that, 9-10 years old. So we need to get to kids younger. In my opinion, we need to be way upstream on all of this. I think we need to get to kids at younger ages, get them comfortable talking about their feelings, get them to understand what feelings are. A lot of young people will say, I didn't know I was depressed. I didn't know that's what this feeling was, that kind of thing. So we need to start talking about it more, and we need to do these mental health wellness checks with people. I just think we need to get more upstream and normalize the conversation about how we're feeling, and how just because you're having thoughts about certain things doesn't mean that that's always going to be the case, and helping people manage through that and get them the right help that they need.
Foster Osborne, good to see
Hi,
you.
can you hear me?
Yes.
Oh, good. I have, I don't know, a little bit of a family tradition of suicide. My grandmother, an aunt, and an uncle all committed suicide. I don't think suicide is bad. I mean, I think there's a lot to be said for it. When you think of Shakespeare, his most famous lines were "to be or not to be," and sometimes the slings and arrows of outrageous fortune get you down, and you figure, well, why bother? I mean, the population of this planet has gone from 1.7 billion in 100 years ago to over 7 billion today. So we don't need more people. And I don't think my grandmother or my aunt or my uncle did anything wrong. My uncle used a gun, but he did it in the back of the yard, so it didn't make a mess. My grandmother stopped taking her medication, so that was kind of a passive suicide, but she knew what she was doing. And my aunt, preferred, she did it the proper way. She stockpiled sleeping pills and then put a plastic bag over her head and tied it. So that's the recommended way. I guess the Hemlock Society is no longer in existence, but they have another organization called Final Exit. And so I sort of feel like your mission is somewhat inappropriate, that suicide's not a bad thing and should be addressed as a viable alternative.
Well, I mean, I respectfully disagree. I lost my 21-year-old son to suicide. He was not a senior citizen who was facing, terrible pain and a terminal illness. So I do hear what you're saying. I think there's a couple things I would just say is, number one, we try not to use the word commit suicide when we talk about it. It's just about having, talking in safe language. Talk about died by suicide, took their own life. Commit tends to almost criminalize or refer to it as like a sin. So we try not to use the word commit. The other thing I would just suggest is, other than statistically talking about lethal weapons, gunshots, things like that, I would just ask that, especially in a larger group, that you stay away from specific descriptions of suicide. I think that can be really difficult for some people to hear. We've got 53 people in the room. You don't know what all these members are struggling with. And sometimes, hearing those descriptions can be very unhealthy from someone who's not in a good place. So just, I hear what you're saying, respectfully disagree, but thanks for the comment.
I listen to NPR a lot, and there are stories from time to time that refer to suicide or deaths, and lately, last several years, especially since the 988 number has become available, you know, they always at the end of the story will say that if you or any of your loved ones are thinking of suicide, call that number. So, you know, I think, I hope that helps, that public radio at least is conveying that message. I'm sure you think it's a good thing, and I just hope it's being effective.
Yeah, there's a reporter in New Jersey, and I want to say Adam Grant, but I know that's wrong because that's another person that, but there's a reporter in New Jersey that we recently gave what we call a Lifesaver Award to, because he reports on a lot of different stories, but when he reports on suicide, he's actually made a real effort to use safe language, to make sure we talk about resources and help available, to get the 988 number out there, to make sure that we don't talk specifically about methods, because honestly, I don't think that helps anyone to understand the issue to know a method, and that tends to, especially when you're talking about contagion potentially, that could cause some issues. So we gave him an award because he's done such a great job in trying to understand this really complex issue and report on it safely. So I think we all need to, you know, think about how we talk about it. Most, like if it's a podcast or a movie, they'll tell you if there's going to be a lot of talk of suicide or specific talk of suicide in it. So you can opt in or opt out when you're listening to it. So for people who are potentially at risk, I think that's very helpful.
Arch, you're up again.
I agree with all the things Beth said in response there. And having been on the line and spoken with people who are on the verge of suicide, young and old, a lot of times they seems like they just weren't being heard. And in many cases, at the beginning of a call, I would think this person's a goner, but you know, we had a non-judgmental way, and we heard them, and sometimes gave some resources, but we didn't give advice. We listened. We're a listening line. And so a lot of these people don't have anyone to listen to them. And so by the end of a call that started out horribly, the people realized that it was, you know, a one-time, maybe they clearly had some underlying issues in most cases, but there was that one, you know, horrible thing that like we all see from outside that was going on that day, a breakup or a failing grade or whatever it was. And that was it. That was the last straw. But then in talking it out and having someone hear them, they realized it was a bad day. It was one bad situation. It wasn't, you know, a reason to end their lives. So I think that, you know, maybe what Foster said has some bearing in some cases, but generally I disagree with that.
Yeah, absolutely. And I think that raises a really good point. I mean, when somebody is in a suicidal crisis, very often that can last from minutes to hours. It's not constant, which is why sometimes we get so surprised and shocked when we lose someone, because they could seem fine, you know, 1 minute or 1 hour, and then, you know, die hours later because the crisis comes on. You know, they talk about it being like tunnel vision. They don't see a way out. They feel hopeless and helpless. But that crisis can sometimes last minutes to hours. So, you know, I think what Arch is saying about you get them to talk, you get them to be heard, you get them through that minutes to hours crisis, and you can sometimes get them safely out of it. So I think that that's so important, and that's why the 988 number is so important.
Yeah. Jim Hewitt?
You know, back to this question. The question is historical. Has there been a change, really, an increase in the rates of suicide, for veterans, for young people overall? Because we've had other questions about the current political climate and different cultural groups. Is suicide rate a constant over an extended period of time? Does it vary significantly from like one country to another, or even within our own country from, say, several generations ago to the present time, or even in the last few decades? Is there any research about that?
If I remember the numbers correctly, I think it was 2010, the number, it was like 14 suicides per 100,000, which is how it was typically measured. And I'm not sure of the exact numbers, and unfortunately I don't have the overall, but it steadily increased. And that's why AFSP put in this Project 2025, because we wanted to try to get back to those, at least back to those previous numbers, right? Because it was going up and up and up. Yeah. And
it raises the question of what are the reasons for an increase in it? I mean, there's something major, you know, historically, socially, culturally, that's going on to drive that. It doesn't just happen randomly.
Yeah, and I know a lot of people have theories on that. I don't know that there's a lot of great evidence for what's causing it. But we do know that it is being reported more and more, and it's being reported by younger and younger people, children. The other thing is AFSP does fund research, and that's one of the things that we are trying to get at, right? And that was the other thing about Project 2025 is let's take, you know, these big areas and try to break it out and be really strategic about putting our focus in on that and see if we can make a difference. And then if we can, you know, what do we do to scale that then? And I know because we're coming up on 2025 at this point, the organization is looking at that and seeing if that makes sense. But, you know, one of the reasons we focused in on hospitals and emergency rooms, because if you look at people who die by suicide, a startling number, like 80% have visited either a primary care physician or an emergency room within, like, you know, the past couple months of taking their life. So it just feels like there's an opportunity, you know, if we can provide a safety net to capture people in those moments.
Beth, are there AFSP operations in all 50 states? How widespread is it?
It is all 50 states. Yep. We're also in DC and Puerto Rico. We actually just announced a chapter in Puerto Rico a couple of years ago. So it is, you know, it is largely a volunteer organization. I mean, in New Jersey, we've got hundreds of people working for the organization, but only 3 are on staff. So, you know, it's largely a volunteer organization, but it is across the whole country, all 50 states. Some of the bigger states have multiple chapters. New Jersey is small enough. We just have the one chapter for the whole state.
That's great.
Well, Beth, thank you very, very much. This was a great, interesting presentation. And you're right, there were lots and lots of questions, and you handled them impeccably well. We have a couple of ways of thanking our guest speakers. One is with, can you show it? A certificate of appreciation, which I will get to you and via mail. And the second way is with the Old Guard salute.
Thank you. Yeah, thank you. Appreciate your having me here. Appreciate all the great questions.
Well, you really were terrific, and we appreciate it. And have a good day.
All right. Thank you.
Bye-bye.